Webinar, your community resource every Friday at noon. Today we've got a really great collaboration. We are having sort of a Hurley takeover, which is amazing. We've got some amazing speakers. We've got Nurse T with us. We've got Nicole Matthews with the Injury Prevention Center. We've got Tia Coles, and we've got Dr. Gordon, as always. So happy to bring all of this expertise to you today. Before we get into some of our great speakers, I want to tell you about an event we were able to have over the past week, and then we'll talk a little bit with Dr. Taylor about our town hall on what parents and caregivers need to know. Over the last week, we've been able to host a group of 55 Howard students at the College of Human Medicine for a few meals. So they're in town for an activity called Alternative Spring Break. These are 55 young people who have decided that instead of doing what a lot of us did for spring break, which was go and have fun, well, I'm sure they had some fun, and party, they have decided to commit themselves to service. And so this past week, they've been doing service with various agencies in the Flint community. They reached out to people on our team and asked if we could sponsor some meals. And I want to shout out Flint in general, because we had so many people in the Flint community come together to really support these efforts. A big shout out to local grocer who provides great meals, great fruits and vegetables to our community. And they did a really nice job helping us feed these Howard students over the few days that we had them. Shout out to Nurse T, who came in for one of the events. I saw her there. Dr. Reynolds came and talked to the students about being a pediatrician, and he's a Howard alum. Mr. Pierce from Hamilton came and talked about what their FQHC does in the community. Jason Trice from Bedrock came through and helped us gift these students some Bedrock t-shirts. So they have green and white Bedrock t-shirts that really represent and will be a reminder of their time in Flint. Omari, who helps us out on the webinar all the time, came through. He's another Howard grad who talked to these students. So shout out to the Flint community. We got to see it in action and how much love we have for Flint and how much love Flint has for students who are getting their education and trying to be in service to the community. So special thanks to Flint and all of the people who made that possible. I'm gonna give the mic to Dr. Taylor so she can talk to us a little bit more about her work with helping parents know what they need to know about e-cigarettes. So thanks, Dr. Taylor.
Hi, folks. I just kind of wanted to shout out my event that's coming up on the 21st of March. So that is not next week, but the following week. And that is going to be aimed at parents and caregivers and what they need to know about e-cigarettes. Specifically, we're going to be talking about the different health concerns kind of aimed at adolescents, both with the use of tobacco and cannabis, as well as both the THC and the CBD components. We're going to have staff from the Genesee Health System, the Genesee Intermediate School District, and the Genesee County Prevention Coalition to discuss different resources that we have in the community and ways that you can get engaged in those. I'm going to be on site. It's going to be in person and virtual, so whatever option you'd like. It's going to be taking place down at the Michigan State University campus and there'll be some light snacks for anyone who wants to go. So just RSVP with that QR code, just so I know how many cookies to get. If you have any questions at all, just let me know. I can also send you guys the flyer if you want to send it out to your networks. Just trying to get the word out about it. Thank you. And it's completely free and open to anyone in the public who would like to come.
Fantastic. Thank you so much, Dr. Taylor. This is a much needed event, and always love to have people come into the FJB building. That's what we affectionately call it. Flint Journal Building. That's where this event will be. And we're excited to get you all in the building to learn more about it. So thank you so much. All right, I think we are pivoting to our Hurley takeover, although Dr. Taylor is a Hurley doc, so the Hurley takeover has sort of already started, but we are gonna shift to, let's see, we've got Nurse T and we've got Nicole Matthews and I see Tia Coles. We got a bunch of really great expertise here, and we're gonna get started. All right, Nurse T, I'm gonna let you take the mic.
Hi, everybody, and I am so excited for everybody to be joining. I'm especially excited to have my friends that I work with every single day at Hurley Medical Center, which everybody knows is a level 1 trauma. We are here to take care of you mentally, emotionally, physically, and to make sure all your safety needs are taken care of. It is with great pleasure that I introduce my friends. My first friend that I am going to introduce is Nicole Matthews. She's very sweet, nice, caring, and she's going to share information to us about safety, safety about where it relates to car safety, talk about burn histories and everything that we do at Hurley Medical Center. So I'm gonna turn it over to her.
Thank you, Nurse T. I really appreciate this. It's such an honor to present. I'm excited more than anything to represent injury prevention, and I probably won't go too deep into one topic. I'm going to do a little share screen action here, but I'd like to begin by I'm going to throw a lot of information out. Simply put, a lot of people don't think about injury prevention, but as Nurse T said, Hurley is the level 1 trauma center in our region, the only one, and we're one of 8 level 1 trauma centers in the state. We are also the only level 1 trauma center in our region. There are 8 trauma regions within our state of Michigan. And I worked in the trauma ICU and saw that so many injuries were preventable. And I'm just blessed to be part of this role to help prevent. So thinking differently about injury prevention, most people don't even think about injury prevention. Getting ahead or working upstream, or I know public health has a mad focus on this more recently, looking at and thinking about how we can get above our injuries and prevent them before they even happen. So research, policy, and education are really what I focus on a lot. And then the education is for the community. It is sharing toolkits. It is focused on what month it is, what observance it is that we're focused on this quarter or this month, and getting that information out, parents as well as clinicians. Because we are also the northernmost trauma center at Hurley, we take all of this information, and how we disseminate that is very strategic. So other transferring hospitals send many patients as well to Hurley. Our the engagement in our community. I am one person, but thankfully I have a whole trauma department and a network of people, partners and friends, and those that I share the information with, and we push this out in any way that we can. The cost of injuries is exponential, and a lot of people don't really think about how the amount of injury prevention, the dollars that it can save. And there are 8 injury prevention. I know someone, when you, Doc, introduced me, you'd mentioned the Injury Prevention Center, and actually that University of Michigan at Ann Arbor, it's the Prevention Center, the IP, there are only 8 in the country. So I wanted to say it's IP, CP, or it's a policy center funded by the CDC. Only 8 of them exist in the United States. So we work a lot with that actual injury prevention center, but we are the trauma department. Often there's a lot of talk about how you have money in your bank account if you don't spend it, or if we can prevent all this, all the opportunities to prevent and save that money, spend it from our bank's society, for our community, for the hospital. And we have to approach it very strategically, because there's no simple solution. If we're doing injury prevention, we are taught by the leaders in our industry that you can primary prevent before something happens, and that you can also secondary prevent after it's happened, to be sure it doesn't happen again. And then we'll also focus on any way that we can get a better outcome once something has happened. And that's why I'm so excited to work with Tia, because there are opportunities that we can prevent readmissions or re-injuries, and down that continuum of care, we can prevent dollars spent, injury, lives lost, and improve the quality of life working down that injury continuum. So I always love this quote from the original Surgeon General. One of our older Surgeon Generals originally had written it, but the proportion of injuries, if they were taking lives the way that we focus on disease, but if we focused on injuries, the public would be outraged and they would demand that injuries are stopped. So there's been a push for injury prevention, more so I'd say in the last maybe 10 years, and I've been in this role about 7. So what I'm going to review is a way that we can stop that and the partners that we do it with. Research, policy, and education I mentioned. I'm going to review some data, some of our state data, some of our Hurley data right here in our community. And then we work all the time, every day with the Michigan Trauma Coalition. So we have the Regional Trauma Coalition as well. And Hurley is the lead agency for Safe Kids Greater Flint. So Safe Kids is part of Safe Kids Michigan, and there's Safe Kids Worldwide. They have an amazing annual conference. People from all over the world attend, and Safe Kids gives us a lot of our toolkits for kiddos for safety. We all know the Michigan Association of Health Plans. I'm also an ACEs Master Trainer, just super excited. I'm participating in the PACE initiative right now, the Drug Endangered Children Program, national and in the state of Michigan. Provide so many supports and toolkits for us also. And then of course that Injury Prevention Center in Ann Arbor. So doing a lot of strategic patient advocacy, trying to catch things before they happen when we can, pre-hospital. And the data I'm going to share with you, it's going to go through that whole age spectrum. So of course, Safe Kids Greater Flint, I do a lot of children's safety, but whenever we can do injury prevention for our senior citizens, it has to be strategic, and we're advocating for those patients. So it is throughout the lifetime. I mentioned the Level 1 Trauma Center. We are also the Level 2 Pediatric Trauma Center here. And the Safe Kids is our partnership that we're the lead agency for with Safe Kids Michigan. So anyone can go to safekids.org. There's so many resources there. And as I mentioned, the Injury Prevention Control Center, the IPCP, okay, I can't get that acronym right, but they're one of 8 and one is right here, and we partner with them all the time. So a lot of great collaborations, nationally recognized and run by data. But most importantly, our programs in injury prevention, they always benefit the community. So injury prevention is one piece of a puzzle, and there are so many. We can look at return on investments. We can look at the scopes of various problems. Of course, everything comes to funding and access and capacity. I'm going to show you a few slides of data right here in our community and who comes to injury prevention or who we can target with injury prevention, that they come to Hurley specifically, because we want to use that data, understand the context of where that injury is happening. It is prioritized the way I'm going to show you by year. So then we can kind of see that vision and plan for the next year. We already know, and everyone knows, everyone only has so much capacity. But if we communicate with our partners and we're sharing programs and we're sharing resources, it's exciting. It's not dire, it's exciting. And we know, okay, if we can predict it, we can prevent it. A lot of my partners say that a lot, but each year we plan our path. If we looked back at pre-COVID, 2017, 18, and 19, I didn't put the exact numbers of our patients. I kind of weighted that out, but I always pull the 0 to 18 and the 0 to 25, those age groups, because they vary. And our complaints, those injuries, we look at the top 3 and we look at the top 5. So we're allocating our time for the year and planning, and again, focused on what observance each month is. And of course, summer safety is different from winter safety. So there's a lot of planning at the beginning of the year. We know that our ages 0 to 25, we get that motor vehicle crash injury in those top 3. We also know that falls are always and consistently with all ages tend to be a #1 injury. I only look at those kiddos and our senior citizens primarily because they're our most vulnerable. So if we can help them first and foremost, I'm always trying to do that, again, based on who's coming in. And these are listed in number of those amounts of people that come in with the injuries. Post-COVID, I'm going to go to this slide. We started finding, of course, that for 20, 21, and 22, the numbers varied. And our 0 to 25 ages, those GSWs, they climbed. We had that in the top 3 there for our injuries consecutive. So as we look at just that one topic of violence that is landing in the emergency department specifically, it really showed us how we look at all the things that relate to potentially that can become violence. So our bullying and our healthy relationships. And coincidentally, at this time, I was a school nurse. So being in the schools with the GISD was very helpful to get the OK to Say programs or helping for supports for families. So that we know if this is happening after age 18 and we can start preventing at age 15, then we can look upstream. So again, these are listed in priority of who's coming into Hurley with injuries that are potentially very preventable. The next slide, I included the numbers for a reason. I think it's important for everyone to see that our other most vulnerable population, our elders, falls are always our number one complaint, but it's like no other injury that the gap between number 1 injury and number 2 injury are so large. Those numbers are increasing where our senior citizens are falling, and we look at each year, those numbers are increasing too. The distance between the number 1 injury and the number 2 injury is quite notable. I think that it's striking. So when we're taking some kind of a data set like this and trying to translate it into an actual outreach program, I think that it's important. Like I'll do a brain sheet like this, for example. We look at who's coming in, how they're coming in. Once they go home, it's a whole continuum. So we're kind of trying to plan. This was just for senior falls for our planning. What were they coming in? Sometimes it was medication overlapping. Sometimes it was the orthostatic hypotension, not taking time at night, not using the walker, or being able to call for help, getting the family involved, enhancing that support system. Just kind of creating a one-page brain sheet about this. Originally did this with our car seat program. How do we get ahead of before the babies are born? How do we get the safety and the tools and equipment into people's hands? And in this case, it's how do we get daily preventative actions into someone's life or into their family, into their support system, so that we can get better outcomes and prevent those things that are unfavorable. Those long-terms, the falls that go into long-term rehabs, or, our goal is to maintain independence for this population specifically. But where are all the places we can screen? Where are all the locations that we can reach out and share the information? So injury prevention is strategic in that the data drives the plan, and that we then define our audience and meet them where they're at. It's a lot of information, and I could again go on just 20 slides simply about one safety program, but that's kind of the day-to-day. The specific data, though, that we use to prevent, if we can, and we encourage people to just learn about injury prevention, and we can prevent terrible issues, we can keep them from ever happening. Some of the programs, I know it's a lot, and thankful for student nurses, and I'm thankful for public health students and health administration students, and my quote unquote free labor that help to get a lot of these programs out over the course of the year. Into our community, we could always increase our numbers. I could always do more, but I get grants for the bike helmets. Definitely working on one day with the policy education and another day with just fall prevention. And although it's a lot of stuff, I think that we've become very strategic about how it gets disseminated and sharing those hospital services and those workflows. reporting on the grants is one part, but then following the research is another. Knowing that we're always quoting and using the most relevant and most up-to-date material and forces that drive the work is, it's really, as everyone knows in public health, it's very important. In our cases, I and our trauma department report to the American College of Surgeons. So as a level 1 trauma center, that is our recommendation or our requirement. So every 3 years, we do a really hard audit, and injury prevention programs and all the work is reported to that American College of Surgeons in our re-verification. So we go out in the community, train groups in schools. Again, those student nurses, I don't know what I'd do without them. A lot of times these were a couple outreach programs, some burn prevention, and a summer camp that we focus for kids on 9 or between 8 and 10 different safety programs in conjunction with the parks and with local EMS. Have that every year. If I'm like Nurse T, if I can get on TV and share the message, I'm really excited to do that, or create materials. We also have partners. We work in the fire stations, doing the car seats. There are opportunities to get appointments for all of the programs at hurleymc.com. So I think it's really important to note that community education, but also we have special needs transportation around car seats. There are beds and adaptable equipment for kiddos and casts and things that some people would never think of. So I love sharing that information and doing in-services for our partners when possible. We're always working on that outcome analysis, on the grant reporting, and making sure that, again, we have the available resources. Everything is, one thing is everything. I say it's not one thing, because every one thing is 10 things, right? So I'm grateful for our partners. If we're doing policy, Michigan Children's is fantastic. Our Michigan's Children, they have a monthly webinar. If anyone ever works with them, or the podcast, Speaking with Kids, we can kind of go up and change things at a larger level. And then again, bring everything right into our immediate community, always in the context of Michigan, and increasing our investments. We're doing this again May 25th. A big push that we have is through Stop the Bleed, advancing first aid in our community, and it's an advanced level of first aid. We teach tourniquet usage. We actually go to Lansing and lobby for more money and lobby for more lessons around just this program, but all the programs. And then what causes the need for a Stop the Bleed program, making sure that we're working with anti-bullying initiatives, working in the school, did Unity Day, a couple of years now. So getting clinicians engaged, educating parents, getting on TV. I love my job. I know it's a niche, and I know it's a lot, but like just for March, I get to focus on Brain Injury Awareness Month and Youth Sports Safety. Focusing on Poison Prevention Week, which I have a huge grant right now from Safe Kids. So focusing our activities around that, and knowing that, the trampolines and our observances, they'll dictate a lot of what happens in March. We just finished Burn Prevention Month, and the next month, of course, as we know, is our Child Abuse Awareness Month. So planning ahead for not only knowing what, of course, child abuse looks like and what it costs our community and our nation and our state, but all the avenues that we can work to get ahead of prevention. And there's so many amazing partners here in Flint. We're so simply blessed to have the people that we have, and the advocates and our agencies here. And Children's Miracle Network, of course, Hurley is also a children's CMN hospital. So we look at all of the things that we treat. And because I'll tend to focus on trauma, those numbers they're substantial. If we can focus on prevention of all ailments, that's amazing. But we have amazing advocates in the city of Flint, and they focus on children's advocacy around trauma. And so does our Children's Miracle Network and our Trauma Center. And if you ever check out the Children's Safety Network, it's pretty terrific. There's a lot of research, injury prevention and toolkits, and I reference them a lot. So I don't have all the answers. And again, I could do 20 slides just on car seats or 30 slides just on senior falls or whatever program, burn prevention, smoke detectors. I love ideas. I'm open to input. I hope to work with the community more, and check out hurleymc.com, please, and search injury prevention. There are a lot of resources. I know Nurse T is going to interview Tia, but I just have to say a shout out because my heart is just, it explodes when it comes to Tia Coles and what they do at the Trauma Recovery Center. The team that I worked with in the trauma department and our emergency department at Hurley, and catching the injuries if they do happen, they are exceptional and specially trained. And if someone has to suffer an ailment, we have Tia on the other end of this trauma continuum to help redirect. And I just so excited she's going to share with you what the Trauma Recovery Center does.
And if it's okay, there's a couple questions for you about some of the programs that you described. And I wondered if we keep Tia here and Nurse T, and I see a couple of questions that were sent to me. And Nurse T, do you have questions too that might have come your way?
I actually don't have any questions.
Okay.
I just want to say good job. And I love the partnership, and I love everything that she's doing for our community. I love the sincerity and the passion, and we really do work as a great team together.
I love the love. I love, like, we've got such great teams who are all collaborative, and it's amazing. So there were a few questions, and so someone asked if you might explain the difference between the trauma centers, right? So you mentioned that Hurley for adults is a trauma 1 center, and that for kids it's a trauma 2, and maybe we could talk a little bit about what that means for the community.
Definitely. And it is important because there are requirements and compliance measures for each of the all hospitals. Of course, they have to meet a level of standard of care. And a level 1 trauma center has to jump through all of the hoops and go through all of the fine-tooth audits. A level 2 trauma center, they're held to a very high standard as well. There are some things that they're not required to do as far as hospital tasks and reporting. And a level 3, again, in the state of Michigan, the American College of Surgeons is a national agency. We also have the Michigan American College of Surgeons Committee on Trauma. There are benchmarks set for surgery and for hospital standards by these benchmark leaders, essentially. And long story short, there is a reason why there are only 8 level 1s in the state of Michigan, and there's distance between them, and they have to have someone on call or available at all times for specific injuries. But those 8 regional centers within our state, the lines are drawn around them for our trauma system for 8 regions. And there are then the 8 regions. We are chairs for Region 3 here in the Saginaw Bay, Flint, Genesee County. Essentially, the whole like thumb area is our level 3 trauma region. So, I mean, I chair injury prevention for our region as well. There are about 20 hospitals in our region. And we have our registry who keeps all of our data here, chairs the registry department, our committee for our region. So they're just layers of the safety net for our community to keep us all doing the best.
That's fantastic. Okay, so one question was what does GSW mean? And gunshot wound, I presume, was the question, the answer there. And then is Stop the Bleed for and open to the public?
Yes, it is. And you can go to bleedingcontrol.org or stopthebleed.com. And there are resources online. There are online classes. There's some virtual. We have trained now just here in Genesee County, all of the Genesee Intermediate School District. Every school in that 17 district area has been trained their medical emergency response teams. It's encouraging to know that there are so many people, medical and community and churches and schools that have been taught Stop the Bleed. And I could do 20 slides just on Stop the Bleed. Well, there are about 40 slides in it. But please learn more about Stop the Bleed. And there are class requests also on hurleymc.com. I accommodate as many as I'm able to.
What does it mean to be a CMN hospital?
Children's Miracle Network. It's a very special network of children's hospitals. We are Children's Miracle Network Hospital.
Yeah, fantastic.
Hurley Children's Hospital.
And then there's the last question is, and I'm going to combine it with a question I have of my own. There's such with injury prevention for kids, right? And one of the first thing we learn as physicians is like the rate of injury in kids, as you kind of described, is one of the biggest risks. And I have ER friends who will never buy their kids trampolines, right? Because of what you've articulated. And I wonder what advice you have to people who are like striking that balance between helicopter parenting and like bubble wrapping their kids and being thoughtful about some of the advice and the suggestions you've made. And, you know, what does that balance look like for people?
I appreciate that question, because the first thing I thought was it takes a village to raise a child. It takes the whole community and the aunties and the neighbors and, you know, community, the sense of community as well, knowing your teachers, knowing all the stakeholders in your community that are caring for kiddos. And then when you said about not ever buying a trampoline, I immediately thought, and don't ever buy ramen noodles either. Because right now we're doing a giant burn prevention push about scald burns and how many kiddos put the ramen noodles in the microwave and they fall on the child and noodles stick. And it is the most horrific injury. And of all of the injuries that we can prevent, there's always a tip or a trick for every topic and for every age group. Safekids.org, it's a blanket website. You can search ages, you can search topics. Everything is at safekids.org. But people don't talk enough about ramen noodle and scald burns.
That's like something that I've learned something today. Like I've heard about it, but the idea that it has made it to the level of like, no, we need to be talking to parents about this in our, well, and people are saying, what are some of the tips? You can't leave us hanging. Like you gotta tell us some of the tips.
I'm always just going to say safekids.org and then hurleymc.com, because you can look at a lot of the programs that we have if you have kids in specific sports. I have handouts and pamphlets and everything. I wish that I had a giant department of, you know, I mean, other than students, which I appreciate immensely, out always pushing and educating. And if I can get more to doctors and clinicians, I would love to.
I'm going to hold you to that and ask you to come talk to our med students. I do not want to, I want to respect your time so that when we call and ask you to come here again, that you will, because that's probably going to happen tomorrow. You're going to get an ask from us to talk more about some of these wonderful initiatives. And we've got wonderful Tia Coles, and I want to make sure she has enough time. But Nicole, so much great data, so much great information. We really appreciate you. Would love to hear more. And I've got questions in the chat, and they're like, what about this? I need to know more. So we will definitely be picking.
Thank you so much. I don't want to leave anyone hanging either.
No, you're good. Safekids.org. We got it in the chat. Appreciate you so much. Tia, thank you so much. Good to see you. I'm going to let Nurse T do your handoff.
Well, all righty. Some great information. And before we transition to Tia, I would like to say is even though we want to protect our kids the best way we can, we still have to be realistic. The key is if there's an injury, make sure you get them to the medical center timely. Don't try to play doctor at home or say that the injury is not that bad. Just make sure your timing is that you respond timely and make sure you get them to the medical center so that they can be checked out. So now, with that being said, I would like to introduce Miss Tia Coles. She is amazing. And she works at Hurley, and she runs the trauma recovery program, which is just awesome. I have heard so many great things about her program and the way that she passionately talks to our patients and our families and anybody that's been impacted by any kind of gun violence or any kind of crime or any kind of issue that have impacted them. So I am going to introduce you to Miss Tia Coles.
Are you guys able to see my screen? Yes, no?
Yes, we can see your screen.
Awesome sauce. So first of all, let me just say, I do love the way we work together at Hurley. We are an amazing team that makes sure the ball is in the air, even if we're not able to catch it ourselves. So I appreciate these ladies and what they do and what they bring, the value that they bring to the community, to the hospital, and to me. That ramen noodle thing was just, Nicole, like, who thinks about that? But as soon as you said it, I said, you know, water boils at about 210 degrees. And think about how hot that is when they're getting those noodles out of the microwave. Like, it's something for me to think about. I have a small one at home. But I want to share with you guys about the Trauma Recovery Center today and what it is that we do. And so the Hurley Trauma Recovery Center, we're grant funded, and we offer free and confidential resources to individuals in Genesee County that have been impacted by crime. So the way I normally sum that up is the things that you see on the news, those are the patients that we treat in our department. One of the great things about our department is that you don't have to report to law enforcement in order to receive services. And when I say it is free, I mean absolutely free. We don't even bill your insurance. We don't want cost to be a barrier to you getting the help that you need. What do we serve? What types of populations? Of course, we do gun violence, physical assault, sexual abuse, domestic violence, child abuse, neglect, human trafficking, which you know is huge in our area right now. I'm so thankful for the GHOST team. We do elder abuse, which is one that we don't talk about a lot, but it's prevalent. We do DUIs. One thing that makes us different from other programs in Genesee County is that we are a 360 program, meaning we treat survivors of homicides or those that have been impacted by vicarious trauma. So maybe it didn't happen to you, but it happened to your cousin and now you're affected, or maybe something happened with one of your children and now you're caring for the grandchildren. Well, you're affected, you're a victim also. And so we make sure that we treat secondaries as well. Services we offer, emergency stabilization, of course. And you say, well, Tia, what does that mean? It means, what do we need to bring you as close to your new normal as possible, right? So if it's something as small as, I have all these kids living with me right now, but I don't have beds for them to sleep in, we help you with that. It's something like, I want to be discharged from the hospital, I'm ready, but I need a wheelchair ramp. We help with that. It could be something as simple as, we have changed locations, we're not able to go back into the house, I want my children to go to school, we don't have uniforms. We do that. So whatever stabilization you need, we try to provide it. We also provide victim compensation support. A lot of victims don't know, but when you are a victim of a crime, you are eligible to receive reimbursement from the state. We do educational and employment support. We do personal protection orders. Not only do we help you fill them out, get them submitted, but we also serve them for you. We do a lot of legal support and judicial assistance. So that looks like going to court with you, helping you with victim impact statements, just allowing a place for you to decompress. We do law enforcement advocacy. What we know is that the brain works different when it's been affected by trauma. And so sometimes we hear things, but we don't hear things. So we're there to be the go-between, to help you talk to law enforcement if needed, to help reiterate what they're trying to say in layman's terms. We do all of that. A big component is psychotherapy. We offer free mental health services. Again, we don't bill your insurance. We're trying to actually prevent PTSD. So we deal with you with acute stress or adjustment disorder. We do relocation and emergency shelter assistance. A lot of times with our human trafficking victims, that looks like reunification. So we send patients all over the country to locations that they feel safe or locations where they have family. We do emergency financial assistance. Oftentimes when a trauma has occurred, income is interrupted. Well, consumer still has to be paid, phone bills, lights, water, mortgages, rent. So we do emergency financial assistance. Something else we do that's really cool is at Hurley, we have what's called a food pharmacy. So we write you a prescription to even receive food if needed, and you can go to the food pharmacy, I think like twice a month, every other week, and fill up with good groceries to sustain your family. We provide transportation. That sounds simple, but when you're in the middle of a crisis, not having transportation can be the difference between you getting the ongoing care that you need or not. So we provide transportation to doctor's appointments, follow-up care, to therapy, taking your kids to school if that's needed. We can also do childcare temporarily if that's needed. You may just need transportation to go pay a bill. We provide transportation. We do home repairs. Things happen. Let's say that there was a shooting and your windows were broken out. We replace those windows. Sometimes it's a matter of replacing locks if it's a DV situation. Sometimes it's a matter of we need to have this whole apartment cleaned for them to allow us out of the lease. We do those things. And then we do follow-up care and community referrals as needed. We try to handle everything in-house, but there are some times that we have to go outside of our Hurley wheelhouse to ensure that you have what you need. And when we do that, we make sure that we're following up with you. We make sure transportation is in place if that's needed. And then we follow back up with the agency so that they're clear on what you need as well. So you say, okay, well, what does this look like? You've been in inception since 2018. I probably have never heard of you. Are you really serving the community? Well, since 2018, we have served a total of 2,387 men, 2,321 women. And then you see it is also broken down by race and by age. We treat patients 0 through the end of life. What does our victim type look like? Adult physical assault comes in. We've served 2,849 victims of adult physical assault. That can be gunshots, that can be stabbing, that can be hit with a baseball bat. Anything that is an assault falls into that category, with the exception of domestic violence, with the exception of any child injury. Adult sexual assault, we've served 177. Child physical abuse or neglect, 18. And the reason that number is so low, I know you're saying, wait a minute, I know we have more injuries or abuse and neglect with children than that. We partner with Voices for Children. They are the expert in the community on treating children that have been abused and neglected. So our numbers in that category are low because we do refer them to the expert. Child physical assault, that looks like bullying. It looks like a fight where someone wasn't the aggressor, all of those things that happen with our children. So we've done 197 of those. Domestic and or family violence, 1,114 patients served. That is a huge category for us as well. Human trafficking, we've served 33 so far. Those numbers look low because some people don't want to report it as human trafficking, so we will put them in other categories, but still serve them appropriately. And then survivors of homicide, this looks like the mothers, the fathers, the siblings, the significant others, and whoever else has lost someone to homicide in our community. That's that category, and we've served 153. DUIs, we've served 4, and hit and runs, we've served 6. We are always looking for more people to serve. And what I tell people is that if the Department of Justice says that it is a crime, then you fall into the category for us to be able to treat you. These are just the main categories that we treat. So you want to know, well, how do I reach you? This sounds great, but how do I contact you? So you can reach our main care coordinator's office at 810-262-7345. They are staffed until 11 p.m. during the week, and they're staffed until 5 p.m. on the weekends. When we're not here, our social work department is amazing. Like I said to you before, we partner together in the Hurley team to make sure no balls fall. And so they will pick up those calls and make sure that you get referred to the right department if we happen to be out of the office. You can reach us by email. It's hurleytrc@hurleymc.com. Provide the victim's name and contact information. Someone will respond within 48 hours. The turnaround is usually within 2 hours, actually, but officially we say 48 hours. And then for the web link, you go to hurley.com, click services. click emergency care, click trauma recovery center, which will be on the left-hand side. And you may say something like, "Tia, that's a lot of clicks." Well, one of the things we do is Hurley is a hub in the community, right? So people trust Hurley, but we want to make it so that we're never putting our victims in harm's way. So yes, there are a few clicks to get there, but it also will not alarm someone who is abusing them or make it harder for them to contact us for services. One of the things I want to mention is that for some people, Hurley is a trigger, right? This may be the place where they treated you, or this may be the place where you watched your loved one die. And so we are able to meet you in the community or to meet you in your home. It does not have to be in the hospital per se. Another way that we safeguard that barrier is that if you come for psychotherapy, you actually don't have therapy on a patient floor. It is on like an admin floor with offices. So you really don't get that full hospital feel, but we're able to meet you wherever you are. You may say, okay, well, do I have to come to Hurley to get this service? We partner with great people in the community. The prosecutor's office refers to us. We've talked about Voices for Children. The Y refers to us. PCPs, meaning your primary care physician, can refer you. There are so many entries into the hospital that no, it doesn't mean that you have to come through our emergency department. It could be any portal to get you connected to us. And even if you've never been connected to Hurley, we open you up so that you can receive these services. We are grant funded, which we said before, and our funds come from VOCA, Victims of Crime app. And so, unfortunately, there's no shortage of funds in that area because it comes from crimes that were committed, sanctions that have to be paid, and money that was seized. So there's plenty of money in that category. But just know that we're here for you. And we're not forcing you to talk to law enforcement or anything else that you don't want to do. We partner with you. Also, you may say, well, how long can I use these services? Our program is designed to be 360 and 3 years. So a revolving door. You can enter the program up to 3 years post-injury and stay in the program from day 1 through 3 years. We will not just stop holding your hand. We will make sure that if you're transitioning to other services in the community, that we partner with you to make that transaction smooth. I will say though, because of COVID, now we all know we're living a new normal because of COVID. That 3-year rule has kind of been suspended. We are seeing cases that have went past the 3 years, and that's because the judicial system is just now picking back up, and a lot of cases are going to trial. And so what does that do? It triggers people. It's like ripping the Band-Aid or ripping the scab off a wound that's almost healed. So I don't want the 3-year rule to deter you from getting help. Reach out. If we're able to help, we usually do. I am a person that I believe in saying yes as much as I can, so that if you receive a no, you know it is because I have absolutely done everything that I can to say yes, and even reached outside of my circle and wheelhouse to be able to do that as well. Thank you for my time. That's all I have to say, but are there any questions?
There are several, because this is amazing and people are so excited about this resource. Every comment is like, this is such a good program. So one is, what is the eligibility criteria for some of these services? If you could talk a little bit about like how people qualify.
Yep, so I knew you were going to ask that. People always ask that question.
Yeah.
And I'll tell you the same thing. You just have to be a victim of crime.
Okay.
So many of our programs are income-based, right? Or location-based. You do need to be in Genesee County or within Michigan. We are currently treating outside of Genesee County. Remember, we're funded by federal funds. So if you're in Michigan, we can treat you. You just have to be a victim of crime. And I will tell you that crime has no zip code, area code, or income level.
Mm-hmm. You said something earlier that you were like, if you're nervous about sort of interacting with law enforcement regarding these services, you don't have to, it's not necessary. Does someone have to provide like evidence of the crime they experienced, like a police report or something like that?
So sometimes we do require a police report if it is an older injury.
Okay.
But generally, if we are getting the referral from the PCP, the prosecutors, our emergency rooms or urgent care, you're usually right in the middle of the injury. So it's easy for us to see what has happened. I will tell you that if a crime happened, and let's say, for example, the prosecutor's office decides to not go forward with charges, that doesn't mean that you're not a victim. It just means that they didn't go forward with charges, but you're still able to receive services.
That's Dr. G, I don't know if you want to come forward. She has a question here that she wanted to ask, and I've got a couple questions, other questions that people had for you. But I don't know if we can bring Dr. G up here, get our Hurley Love Fest going.
Yes, awesome. I was just asking, do you offer, like you said, you help all over Michigan? Do you offer like telehealth services as well for those that are outside the Genesee County, or do they have to come actually into Hurley?
No, well, we do have a consent form that has to be signed. And if we have to take that to you, of course, we can make that happen. But yes, we do offer telehealth services. We generally try to stay in person, but that doesn't work for everybody, right? And one thing we've learned about COVID is we can almost do without a brick and mortar for certain things. So we do offer telehealth services, especially for patients that we have relocated. Remember, we relocate outside of the state of Michigan. So if they want to continue treatment because a therapeutic relationship has been met or built, we do offer telehealth.
That's awesome. Thank you.
You mind talking a little bit, you've alluded to some of this and how your work has had to alter due to COVID, but can you talk to us a little bit about some of the changes that you had under COVID and what that pivot has looked like for you and your agency?
Absolutely. The biggest one is that telehealth piece. We did not offer that before COVID. And so being able to offer that is amazing. The other thing that has changed post-COVID is our willingness to meet you wherever, right? Of course, we did business like traditional doctors, traditional hospitals, you have to come here. But now that change is kind of like, no, we can do treatment anywhere really for the department that we have. And so it has changed in terms of what that looks like. So those are the two biggest components with COVID is the telehealth piece and the piece about meeting you anywhere. We even went so far as to using, because we had a lot of COVID positive patients as well. So using iPads to communicate with them while they're in the hospital to prevent exposure.
Yeah, absolutely. That's fundamental. That is amazing work that you are doing. There was a slide that you showed, and it looks like assault was like significantly high in 2021, like just, and I don't know if you noticed if for you use of resources was really high, but like it was that, did you feel like that was a response to COVID or there was something that happened there?
So let me tell you, absolutely. Violence increased, crime increased due to COVID. You have to remember, people spent a lot of together time.
Yeah.
And so we weren't used to doing that. And so what happens is all that together time, you don't have an outlet. And so violence increased significantly. We also had restless teens during that time. So there was like this huge community party, like in one of the parking lots or something. And gunshots rang out. And so we had a lot of victims from that. But COVID really drove the numbers up. And when you look at these numbers, I want you to look at them with a grain of salt, because think about this. These are the crimes or the victims that actually reported.
Yeah.
So many of them did not.
Right. I'm wondering, as you say that, I'm wondering if Nicole saw similar changes or a similar trend in data regarding injuries, right? Like, were you seeing more utilization of services during COVID related to similar things? People were home and like kids, you know, when kids are home, they throw themselves off things. At least mine do.
We had an unparalleled number of kiddos that would come in and get a cast. You know, if a child breaks their leg, they end up casted all the way up to their breastbone in hip spica casts. One time in a short, like maybe 3-week, 4-week span, we had 5 hip spica kids that we maybe only have one every couple of months. And that happened a few times actually during the lockdowns. The Michigan Trauma Coalition published as well a article about our state trauma registry showed a 30% increase in our violence-based injuries. And I can send you a link to that as well.
Yeah.
It was data driven, and I quoted Tia in the article, as a matter of fact, because we were seeing such an increase in that in our policy networks.
And it strikes me that where child assault or child injuries happen, that you all might end up collaborating, right? That I'm sure you've had spaces where, you know, there's a handoff from Nicole to Tia, or Tia, there's, you know, collaboration on resources. Does that actually happen? I can imagine, like, you all are in the same wheelhouse, especially when we're seeing kiddos, and right, like you've got child physical assault in 2021 of 63.
So we collaborate all the time,
Yeah.
and talk all the time, just because we are penetrating the same problem, but at different points.
Yeah, that is, well, I want to thank you for all of the work that both of you do. While I have Nicole here too, I want to think about some injury prevention tips that you want to leave people with, right? So that was the last question that we got to, and I want to keep Tia here because as much as you collaborate, I'm sure all of you've got some tips for the community that you want to leave people with. So Tia, is there anything you want to leave people with in the 4 minutes that we've got left? Things to remember, resources that you have for people to remember, and then I'm going to ask Nicole to do the same.
So the one thing I would just encourage you to do is get help. We're here to help you, and we're trusted, tried, and true. Our goal in this department is to take you from victim to victor. So if that means we have to hold your hand, we're going to hold your hand. If we have to cry with you, we're going to do that. But know that we're here to serve you. Our goal is to keep mainly our babies. This program came about because at one point we had the highest number of gunshot victims in the nation in Genesee County. And so our goal is to keep our children from leaving this hospital in a body bag. So if you need the services or you know someone who can benefit, please reach out.
Thank you. Can you go back to your slide that has your reach out information just so people can take a picture
Absolutely.
of that? And okay, so contacting Hurley TRC, you've got the phone numbers, you've got an email, and she says someone will respond within 48 hours. Thank you. Nicole, as you think of general sort of tips and tricks that you want to leave people with, and we think about, you know, what are the injury prevention things, even the small thing that you mentioned, I agree with Tia, like that the ramen noodles didn't come to me. And then when you said it, I was like, absolutely, right? So if you got any more tips and tricks like that you want to leave people with, we'd love to hear them.
I think that a lot of the programs, it can be any of the injuries, from practicing fire prevention by having escape plans in your home that you practice with your kids, and you also practice them at night, or if it's something you're in the car. If you're not in your home, you're in your car, right? So the breadth of car seat related and child passenger safety tips, not kidding, I could definitely do 20 slides, but the mindfulness about it is knowing that, you know, you have to build in a little extra time to be careful. Take the time to pause and take a breath and make a safe choice, and put that chest clip up on the bone where it needs to be on their car seat, and be sure that everything is secured. You know, it takes an extra minute, or stop and don't look at your phone, but focus on the kiddo that's near the water source or something, whether it even be in the bathtub, paying attention. There are so many ways that we can prevent a lot of injuries, whether it's the home or the car or out in the community, just by stopping and building a little extra space and time into that moment to pause and be sure that you're safe. Or for our senior citizens, pause and don't move forward until you sit on the edge of your bed for a little bit and let your blood pressure regulate, because so often those falls are next to the bed or between the bathroom, and sometimes it's just rush, and the world's telling us to rush. And you know, we can be a lot safer if we just take an extra moment too.
I appreciate every single one of those tips. Me and my kids' car seats are nemesis. Like they're like my husband deals with car seats because I'm just like, I'm a whole med school and can't figure out a car seat. It doesn't matter. They're like awful, awful.
And I will also say that because car seats are not the bane of my existence, but close enough because I'm always buried completely. But, Hurley has everything from way before the birth to the, the very young children. You have support systems through this whole continuum of age for the lifetime. And there's a reason why this amazing hospital has been here for over 100 years and has the trust and respect relationships that it has over so many decades, that because it supports every stage of life.
Thank you so much. All right. Well, thank you both for these incredible resources. We're super thankful, and we're going to be bringing you back. Special thank you to our partners, Hurley, GHS, McLaren, Genesee Community Health, all of the ones you see on the screen. And we will see you next week. A reminder for those community health workers who can get continuing education credits. We'll see you next week. Thank you so much.